Welcome to CDMO Live 2025, live from the World Trade Center, Rotterdam. You join us in the podcast studio, which we're sharing with Molecule to Market and sponsored by Qualifies. And I'm delighted to have our first guest here, Ryan Kelly from Rx-360, who's going to be talking about what's probably the big problem of the year, uncertainty. And we're going to have a conversation about how to plan for the unplannable. Ryan, first off, welcome to the podcast.
Thank you for having me, and thank you for the invitation.
And how are you finding the event so far?
Incredibly well done. The opening session, very well produced. I thought it was a great session to start. I thought Simon Kutscher's presentation was very good. Mm-hmm. The panel was very informative, so I think you're off to a great start for the event.
Okay, fantastic. Thank you. Nice to hear. So yeah, tell us about you, please. Tell us about Rx-360 and how your members are getting through these challenging times at the moment. What are they telling you?
So Rx-360, we're a nonprofit member consortium. We are made up of approximately 130 manufacturers, suppliers, distributors, and contract logistics and 3PL providers. And so our mission is to share information, develop processes to safeguard the quality and security of the supply chain. As you've stated in the beginning, this has been a very uncertain year. There's certainly a lot going on. And so our members right now are really just focused on sharing information, again, similar to what your panelist was speaking about, being under an antitrust umbrella. But we do share a lot of the different experiences that we're having, how we're managing those things. The geopolitical risks right now are seeing an uptick, and so we meet bi-weekly for different areas to discuss challenges in the Red Sea, challenges in Eastern Europe and Ukraine, and now I'm sure next week or either sooner, the events transpiring right now in between India and Pakistan and the potential implications on the pharmaceutical supply chain are as significant as they are, with India being one of the leading manufacturers in the world. These are areas where our members are going to be keenly focused on sharing information and experiences and how they're dealing with these challenges.
Yep. And which type of companies are we talking about that are your members? Companies, and also the roles that they play within those companies.
So we have a very active membership, and so we'll have major pharmaceutical manufacturers, the household names, as well as major distributors with global operations, and then many of their service providers. So that could be CMOs, CDMOs, CROs, as well as their logistics services providers. And so they're all coming together to share information on what they're seeing in the market, what challenges they're experiencing, how they're going about managing through and developing additional resilience. Yep. And really how they're just focusing right now on maintaining continuity and maintaining the ongoing patient supply. Ultimately, their goal is avoid patient disruption.
Of course, yep. Could you give us an example of that, please? Maybe a recent example of that sort of supply chain disruption and what that looks like from the point of view of your members.
So the big thing is, if we look at an event like last week, the power outage on the Iberian Peninsula. So we significant disruption to just the entire society of Spain, Portugal, and France. And so for our members who had operations in the region, their big thing was they were able to implement a already existing continuity plan quickly. They knew which product they had in market. And so, again, they're going to first move to redundant power, make sure they have high-value medications that are secured, maintaining the quality, maintaining the efficacy. And then as soon as operations resumed the subsequent day, they had triage plans in place to make sure they knew who the patients were with the highest priority, healthcare providers with the highest priority, and making sure they're effectively triaging those orders out based on the really patient priority. And so, again, they had plans in place. They knew where their inventory was. They had awareness of what was going on in the market, and they were able to rapidly coordinate, not just to work back their backlog, but also there was an upcoming bank holiday the subsequent day.
Yeah, of course.
And so they needed to work ahead, and so they hit the ground running. They were prepared.
It's a really interesting example, and obviously you mentioned the exposure to many members in India at the moment as well. I mean, what would a contingency plan look like for that sort of event?
This is going to be a challenge, considering the significance and the volume of, especially if you look at somewhere like the generics, which are 80+% of all drugs that are consumed are generic pharmaceuticals, and the global leader in that market is India. And so any type of disruption to product supply, ports, or global trade could be drastically significant. And so they'll have redundant backup plans in terms of where are alternatives that we can produce these products. But a key strategy is going to have to be, can we look to our CMOs, our CDMOs, to help us bridge that gap and potentially produce those products, or look toward where do we have redundant supply? Where do we have alternative production and packaging facilities that can be alternative suppliers of those drugs?
Yep.
And so I think for you and your audience here in the CDMO space, their role going forward is already critical, and this level of ambiguity just makes it all the more critical.
What advice would you be able to share with us? Almost like a I suppose a checklist of how to deal with this sort of, supply chain uncertainties, disruptions. Is there like a go-to list of best practices which you could recommend?
I would say the first thing is know your supply chain. Make sure you have it well mapped. Make sure you understand it. Know who your suppliers are. Know who their suppliers are. So in many cases, double-clicking. And some of the things that we'll find if we're looking at disaster recovery, business continuity, many times your primary supplier and your secondary supplier may be sourcing from the same supplier.
Okay.
And so making sure you understand those dependencies and you've well mapped out your supply chain, know where your alternative options are. And then I would say that the biggest thing that we've seen coming out of COVID and a lot of the investments that manufacturers and suppliers made in that time period was investments in technology. And so that could be sensors, integrating IoT with their ERP systems, their capacity planning, their demand planning and forecasting systems. Pharmaceutical traceability in the United States, we have the FDA's Drug Supply Chain Security Act. And in Europe, we have the Falsified Medicines Directive. And so some of those legislative requirements are also increasing transparency and visibility into the supply chain. And so know what your supply chain looks like, know where your inventory is, and if you do that, it will help you be more prepared to respond to the unexpected.
Yep, great, thank you. And then one final question. I mean, we've talked about how unpredictable everything is at the moment, and it feels almost like just getting through the days is a challenge. But if I could ask you just to sort of think forward, perhaps, 2-3 years ahead, what would you see as something which you believe is going to change and improve? Is there a trend which you think is really important to your members?
I think what we're seeing is, coming out of the pandemic, we saw a lot of innovation that was spurred on and really expedited. And so I always try to work backwards from the patient. And so if we look at some of the new innovative models from Eli Lilly, who has partnerships with Amazon, among others, of direct-to-consumer pharmacy models. And so we're seeing a lot of disruption in the space that way. But given the advent of telehealth services and increased analytics and just the ability to synthesize data rapidly via our smartphones and connected devices and manage our own healthcare, I think if we work backwards from the patient, you're just going to see a lot of innovation in the supply chain and getting those products to the patient. And what that's ultimately going to require is that our manufacturers and our suppliers are going to have to work backwards from that as well.
Yep.
And be more open to more innovative models and meeting customers where they are, which is they're expecting faster delivery, more insights into their own health and wellness, and taking more ownership. And so I think as we look at that, it becomes more imperative that our members know their supply chain very well and are flexible at a product level to understand they don't just have a single supply chain. Every single product has its own unique set of supply chains in the market. And so knowing all of those, so they're able to meet customers where they are and deliver more innovative solutions. And so I think over the next 2 and 3 years, we're going to see rapid iteration there, and that will ultimately play out globally as well.
Great. Ryan, thank you so much for joining us today. Pleasure speaking to you.
Pleasure speaking with you.
Thank you.